Children's was notified the week of June 14, 2021 of a voluntary equipment recall from Phillips Respironics. This company provides ventilators, BiPAP devices, and CPAP devices that provide breathing support. This recall is due to potential health risks associated with the polyester-based polyurethane foam inside the machine and the potential that it breaks down. According to Phillips Respironics, there is a risk that this foam can break down and then enter the device's airflow path and be ingested or inhaled by the patient. There is also a potential risk that the foam may off-gas certain chemicals. The potential foam breakdown may be increased by the use of unapproved cleaning methods in high heat or high humidity environments. Per Phillips Respironics, the potential risks of particle exposure include irritation to the skin, eye, and respiratory tract, headaches, asthma, and adverse effects to other organs, for example, the kidneys and liver. Additionally, there is a potential toxic carcinogenic effect. The potential risks of chemical exposure due to off-gassing include headaches, dizziness, irritation to the eyes, nose, respiratory tract, hypersensitivity reactions, nausea, vomiting, and potentially toxic carcinogenic effects. There have been no reports of death as a result of these issues. Your child has been identified as a patient who may be currently using or have used one of these devices in the recent past. Devices affected by this recall include Children's has carefully reviewed this recall with Dr. Casey Berg, who's the Clinical Service Chief of Pulmonology, as well as myself, the Medical Director of Children's Respiratory and Home Care. After carefully considering the risks of ongoing use of one of these recalled devices versus the risks of discontinuing use of a breathing support device, as well as carefully reviewing the recommendations provided directly from Phillips Respironics, we are issuing the following general recommendation. However, we are happy to discuss your child's individual case if you have questions or concerns regarding these general recommendations. If your child is using a recalled ventilator, BiPAP device, or CPAP device, we recommend placing a filter in line as described in attached literature and continuing to use the device. The use of the filter as described offers potential protection against the foam particle exposure. However, it should be noted that the filter is not expected to alter the potential exposure to off-gassed chemicals. For questions or concerns, please contact your home healthcare agency. If your child receives their supplies and support through Children's Home Healthcare, you can contact our respiratory therapist at 402-955-7777 and click option number 5. We at Children's are here to help you through this recall process, so please don't hesitate to reach out to us in any way that we may be of assistance.